Hello everybody, we welcome you all from the Gynaecology Oncology team at Narayana Health Center. I am myself Dr. Abhirami, who is a fellow in Gynae Onco department, and here with us is our consultant Rohit Ranade. Welcome,
Hello.
sir.
Hello.
So on the occasion of International Women's Day, that is on March 8th, we are here to discuss about the most common diseases which is occurring in the women's health. And of that, we would like to discuss on ovarian cancer, which has been the most deadliest cancer with lots of morbidity and mortality, and also the 8th most common cancer in the world. So hello, sir.
Hello.
What is ovarian cancer, sir?
Yeah, so as you have rightly said, it's one of the cancers where we are seeing that the incidence is increasing. 20 years back, cervical cancer was the commonest cancer which was seen in our OPD. But now we are seeing more and more ovarian cancer cases coming to us. Now, to know about ovarian cancer, what is ovarian cancer? So, if you have to know what is a female genital system. So, you have a uterus, which is also the baby bag. On side of it are the two tubes, which are fallopian tubes, where the formation of baby occurs. And on the sides of them are some known as ovaries. So, ovaries basically are responsible for producing oocytes, which are necessary for the formation of baby. Another important functions which the ovary serves is they also produce two hormones, which are estrogen and progesterone, which are responsible for a lot of functions in our body. Like they are protective to the heart, they are essential for maintaining the health of your bones, also the blood supply of your skin, and overall they are important for maintaining a hormonal milieu. So, like any other organ, this organ can also develop into cancer, and that is when ovarian cancer occurs.
So, this ovarian cancer occurs in which age group of women, sir?
Yes. So, to know that, you need to know what are basically the types of ovarian cancer. Now, the commonest ovarian cancer, which is an epithelial ovarian cancer. Now, epithelial ovarian cancer is when the cancer occurs from the lining of the cells of the ovary. This is mainly common in after 50s, that is in the 5th decade or the 6th decade. But of late, we have seen a change in the trend where we are seeing more and more young women come to us diagnosed with ovarian cancer. The second most common type of ovarian cancer that we see is known as germ cell tumors. Now, they are essentially which arise from another lining in the another type of cells which are present in the ovaries known as the germinal cells or the germ cells. So, they are cancers which occur primarily in young women. Like we see women as early as 15 years, 16 years. This occurs in young girls, also in women in their 20s and 30s. So, this is fairly occurring a younger population. The other third most common type of ovarian cancer is a sex cord stromal tumor. It is the another third cell which is present in the ovaries. They are also in this. There are some cancers which occur again in the 5th and the 6th decade, but there are some cancers which occur also in the young population, mainly in the 20s and the 30s.
So, what is the risk factor, or you say the causative factor for ovarian cancer, sir, in young women mainly?
Yes. So, as I said, we are seeing more and more young population or younger women coming diagnosed with ovarian cancer. Now, if you ask me what is one risk factor which is probably responsible for ovarian cancer, is that we don't know what is the answer. As compared to other cancers like lung cancer, where we definitely know that high amount of cigarette smoking is causative factor for lung cancer. For mouth cancer, it is tobacco chewing. It is for cervical cancer, it is a human papilloma virus infection. But unfortunately for ovarian cancer, there is not a single risk factor. There are multiple risk factors. Like for example, anything which is increasing the estrogen in the body. Like for example, late marriages, then less number of childbirths, obesity, hypertension, prolonged use of hormonal tablets is also known to cause. Women who have taken treatment for infertility, and especially in whom infertility treatments have failed, they are at significant risk of ovarian cancer. Another important risk factor for ovarian cancer is a genetic tendency. So there is about 25 to 30% of ovarian cancers are now supposed to be genetic. That is, they go from mother to the daughter.
So what are the symptoms and signs they present with?
Yeah, so unfortunately, like any other cancers which has some specific symptoms, ovarian cancer is one cancer where there is no specific symptoms. And that is probably the reason why most of the patients or 70% of patients come to us in advanced stages. Now, the common symptoms which might be just be a bloating in the abdomen, like fullness of the abdomen, or just a sensation of not feeling well. or if the tumor is sort of pressing on the bladder or on the rectum, then you might feel that the lady might feel that she is not able to pass her motions correctly, or you might feel that you have to go to the toilet and you feel that you have not evacuated properly. Another thing is that increased frequency of passing urine and a sensation of incomplete evacuation of urine is also an important symptom. There are some types of ovarian cancer which present with menstrual irregularities, like for example excess bleeding during periods or bleeding in between periods. And late stages, obviously there will be symptoms like weight loss and other things like the fullness of the abdomen and everything that symptoms are.
So what is the women subjected to, like when she comes to our OPD with the symptoms, what are the investigations they are subjected to, sir?
Yeah, so depending on what are your symptoms, primarily the lady needs to undergo an ultrasound scan. First, a detailed history taking and a clinical examination is most important. After that, you might be asked to do an ultrasound scan, and also we do some other special investigations known as tumor markers. So they are mainly CA125, CEA, and CA19.9. And for germ cell tumors in younger women, we do something like alpha fetoprotein and beta HCG. Now, what is a tumor marker? So, tumor marker is basically they are special proteins which are secreted in the blood, which increase in which their level increases when the lady has a particular type of cancer. Now, there is an important thing which you need to remember. Not every lady who has an elevated CA125 has cancer. There are also other reasons why CA125 can increase, like for example tuberculosis or endometriosis or even fibroids. So that is something which you need to remember. After that, once on the ultrasound we have picked up an ovarian mass, you might be asked to undergo either a CT scan or an MRI scan. Most of the time these investigations are more than sufficient. Also, one more thing what I would like to add is, unlike cervical cancer, where we definitely know that doing a pap smear or doing a HPV DNA above 30 years of age or doing a visual inspection with acetic acid, something known as screening, has definitely known to reduce mortality. But unfortunately in ovarian cancer, there is no screening modality which is known to reduce the mortality in the population. But still, those who are affording or those for whom it is possible, you can undergo an ultrasound once a year.
So what are the treatment options and how do you plan the management, sir, with ovarian cancer?
Yeah, so as far as management is concerned, it depends upon what is the presenting stage. Now, as you know, there are 4 stages of cancer. The main treatment modalities in ovarian cancer is surgery and then followed by chemotherapy. Now, for that, determining the stage is most important. The most important part or the most important treatment modality in ovarian cancer is surgery. So, usually, roughly for early stages, that is stage 1, 2 and very early stage 3, surgery is the modality of choice. The surgery is a complex one, or it's a lengthy procedure where you need to remove the uterus, the ovaries. In this, mainly the surgery is done by open way, because there are trials which have shown that doing a laparoscopic surgery or a robotic surgery is inferior to open surgery. So, which involves, as I said, hysterectomy, removal of both the ovaries. In addition to that, you also need to remove the omentum, which is a fat layer which comes from the stomach where these cancerous cells can go. In addition to that, there are also some lymph nodes which need to be removed. And you need to know that ovarian cancer is a disease which affects the peritoneal lining. So, you also need to do a procedure known as a peritonectomy. So, most of the times this is the treatment. Depending on that, we usually send all these to a detailed histopathological examination, and depending on that, you might need to undergo chemotherapy as well. Now, for conditions where or stages or cases where primary surgery is not possible, there is an option of giving chemotherapy before surgery known as neoadjuvant chemotherapy, where we give 3 cycles of chemotherapy before surgery, reduce the disease, and once the disease has reduced significantly, then you can go in and do a surgery. So, it's always a combination of surgery and chemotherapy which is important. One of them may not be effective So it's always needs to be a teamwork, and you need to have a very, very good ICU setup, very good team of dedicated anesthetists, obviously your assistants and fellows, because it's a prolonged surgery, and you also need a support of all the allied departments as well.
So when it comes to an ovarian cancer in young women, like removing uterus and ovaries will not be so appreciated by them. So what are the options they have? What is the fertility sparing surgeries which are provided to them?
Yes, that's a very important question. I feel in a situation today where we are seeing more and more young population coming, and who unfortunately who don't have kids and who still want to go ahead and get pregnant and have kids. Now, in them, there is definitely an option known as fertility sparing surgery. So, in whom where the tumor is restricted to even only one ovary, and where it has not spread outside to any, there is an option of removing only that ovary, and at the same time preserving the uterus and the other normal ovary, but doing the formal staging, like doing the omentectomy, doing the lymph node dissection, doing the peritonectomy if needed, and then giving chemotherapy if needed. And then later these patients can go and plan their normal pregnancy, and they can lead a normal life further. So this is a change which has undergone as compared to the previous guidelines. Also, one more important thing is, in germ cell tumors, which are primarily chemosensitive tumors, even in advanced stages, we can offer them a fertility preserving option. That is, there is an option that we can preserve the uterus and the other ovary, because essentially germ cell tumors, they respond beautifully to chemotherapy. So fertility preservation should be the goal for these cases.
So what about the treatment with immunotherapy, sir? When do you propose that for the patient?
Yeah, so as of now, immunotherapy in ovarian cancer is still an experimental treatment. It is still not the standard of care, though there have been some promising studies which of late which have been coming, and we definitely hope that with more and more data, we will have some good results and good benefits of immunotherapy in ovarian cancer. One thing what I would like to tell is something known as targeted therapy. Now we know that, as I told you, about 25 to 30% of patients will have a genetic preponderance. Now, the most important gene which is responsible is known as a BRCA gene, that is a BRCA1 or 2. Now, in women in whom the BRCA1 or 2 is mutated, it is known that they show a substantial response and they have a substantial benefit to a new class of drug which is known as a PARP inhibitors. Now, the good thing about that is they are available in a tablet form. So these are known as maintenance therapies. That is, after you have finished surgery, after you have finished therapy and the lady is free of the disease, then you put them on maintenance tablets known as PARP inhibitors. And they have shown a significant survival advantage which no other targeted therapy has shown till now. They are easily administered because you can just take the tablet and sit. You don't need to come to the hospital to take the tablet. They have very minimum side effects or no side effects at all. And so overall, it is quite a win-win situation for especially those patients where the BRCA is mutated.
So what about the follow-up with these patients?
Yes. So it's very important that once your treatment is done, there is something known as an aftercare as well. So what we do is they need to come for every 3 monthly checkups to the clinic for the first 2 years, and then 6 monthly for the next 3 years. Every time we don't need to do an imaging like a CT scan or a MRI scan, but it's essential that a clinical examination is done, and depending on the history, then we decide whether we need to do any imaging.
Okay. So what about women with a strong positive history, like a family history, whether they have a breast cancer or ovarian cancer? What is the recommendation for such women, like in a young age?
Yes, so that is also something which is very, very important. For these women, it is primarily important that if there is a living patient, like somebody in the family who has a breast cancer or an ovarian cancer, they need to undergo something known as genetic testing first, because you need to know that if the genetic test is positive, obviously counseling is something which is very important, because the lifetime risk for a lady to develop a breast cancer is 80% and ovarian cancer is around 40%. So suppose there is a patient in the family who has an ovarian or breast cancer, you need to test that lady first. Now, if suppose they have the mutation, then the other family members also need to be tested. Now, does that mean the end of the world for somebody who is tested positive? The answer is no. So there are good prophylactic measures or good strategies by which their lifetime risk of breast cancer as well as ovarian cancer can come down. Now, definitely they can be offered a risk reducing strategies or known as bilateral salpingo-oophorectomy. That is, you remove both the ovaries and the fallopian tubes after the age of, say, between the age of 35 to 40. So this has seen that there is a 96% reduction in the risk of getting an ovarian cancer in this case. There are also some women who can be offered a bilateral mastectomy, which has shown a 96 to 97% reduction in the risk of getting breast cancer. Or they can also be advised to do a regular screening, say every yearly, with a breast MRI is what is recommended.
So one last question, is there a way to prevent ovarian cancer?
The answer as of now is no. We can't prevent ovarian cancer, but it's just important in our hands to not neglect any symptoms. On this Women's Day, it is very important that women are aware of whatever symptoms they are having, and please don't neglect your symptoms. And if possible, please get an ultrasound scan once a year. It's very important for you to know that ovarian cancer diagnosed in early stages, the 5-year survival is more than 90%. So please don't neglect your symptoms. Please seek help and adequate advice.
Thank you, sir.
Thank you.
I hope we have clarified all your doubts about ovarian cancer. Thank you.